maternal health package. Thank you. There's a lot of power in Concord today, and we're excited that the room is so full. We're here today because Momnibus 2.0, Senate Bill 246, is a real game changer for moms. It's a maternal health package that is going to do amazing things for the moms and families in our state. And I'm really excited to introduce the sponsors of today's bill. So up first, we're going to have Senator Denise Ricciardi from Bedford.
Thank you. Good morning, everyone. Thank you so much for joining us today. This is an exciting day as we introduce Momnibus 2.0. I'm so proud to sponsor this critical legislation that will impact moms, babies, and families across New Hampshire. Momnibus 2.0 builds off the success of Momnibus 1.0. Momnibus 1.0 was a bill that I co-sponsored 2 years ago with Senator Whitley, which began the work of improving services for moms so that New Hampshire families can be healthy and be strong. We had unanimous support in the Senate, and it passed in a biannual budget with broad bipartisan support, and Governor Sununu signed it into law. We are already seeing positive effects of this legislation, with many more moms able to get postpartum care that they need. But the work is not done. Moms need support, and that's why I'm here today to introduce Senate Bill 246. Momnibus 2.0 addresses critical maternal health gaps in New Hampshire through smart investments and key policy changes. Senate Bill 246 improves maternal health, it expands family supports, it strengthens workforce protections, and offers support to moms across New Hampshire. Senate Bill 246 is going to improve maternal mental health, screening, and address barriers to accessing that mental health care. The bill gives resources to our providers so they can feel prepared to address maternal mental health with their patients. The bill also provides emergency labor delivery training for EMS providers in our rural communities. That's essential. It studies opportunities to support independent birth centers, and it starts the ball rolling on what a perinatal peer-to-peer support system would look like. It ensures moms can attend postpartum appointments, and parents can bring their babies to their pediatric appointments. It expands access to critical home visits to new moms in the first year of their babies' lives. I am so proud that Momnibus 2.0 has bipartisan support again, because making sure moms, babies have the support they need is something everyone can get behind. Supporting our moms and families is a shared value across the state and across party lines. I'm so proud to be introducing this legislation with my colleague and friend, Senator Sue Prentiss, who shares my dedication to this bill, and we've been working together with all other representatives, Republicans and Democrats alike. We are excited to support our moms and our families. This is the New Hampshire way. Thank you for being here today. Sue, would you come up?
Good morning, and thank you, Senator Ricciardi, for, here we are, Senator Ricciardi and I have had the opportunity to be together working on what we call the OG, the original Momnibus, and here we are again. This is such important work, and your partnership and your friendship in working on behalf of moms in New Hampshire has been so important to me, and to both of us, thank you.
Back at you.
Okay. Well, and good morning, everyone, on this cold morning. Thank you for joining us in Concord. As my colleague, Senator Ricciardi, in her delivery of her remarks, what she's highlighting for you and what I want to highlight for you this morning is that when New Hampshire moms thrive and New Hampshire babies thrive, then New Hampshire families and the communities that they live in thrive. They are the bedrock of the Granite State. But what we all know, now I'm a mom, Senator Ricciardi's a mom, there's many moms in this room. My Phoebe is 27 years old. And so it's been a while. But we know that being a mom is the greatest joy of your life. but it comes with a set of challenges. And for some, these challenges are felt differently and more deeply than others. Maternal mortality, not just in northern New England, not just across the nation, but in New Hampshire, has been on the increase. And our focus in working on Momnibus 1.0, and now as we're talking about 2.0, is to stabilize and decrease that by how we wrap around in a comprehensive bipartisan approach. As mentioned, the Momnibus 1.0, one of the key things that we did there, and this is it's a little over, it's about 2 years ago, is we extended the postpartum Medicaid coverage. This was an extension for moms that were on Medicaid during their pregnancy from 60 days to 365 days. And I know this is from the last bill, but it's important as a foundational moment here because medical issues, mental health issues, substance abuse treatment, all of the things that come in that postpartum state don't shut off at 60 days. Having a full year of continuous coverage and continuous care is how our moms are building and thriving in our New Hampshire communities. We added into that package donor milk, lactation consulting, doula services, again, starting that very fundamental place. So now we're taking that Momnibus 1.0 and building with 2.0 on that foundation that is so key, and I believe takes, as Senator Ricciardi said, I know, takes a more comprehensive wraparound approach. It's important to me that there are a number of provisions that Senator Ricciardi outlined, but I want to talk about two that are particularly important to me. Many of you know that I have served as a paramedic in the state of New Hampshire and predominantly in the North Country, in the more rural areas of our state, as well as previously served as the Chief of Emergency Medical Services, where we did work preparing emergency medical technicians to handle not just laboring moms and moms that are, needing just some support with delivery, but deal with some of the complicated cases that may come up. In the last 20 years, this is important because in the last 20 years, 11 of our labor and delivery units have closed. Okay, they have changed the way that they function, which means that our moms are laboring and delivering further away from their core base. Some of them don't even have the transportation they need to get where they need to go. So should they face an emergency, it is incumbent upon us, and this bill addresses this, to make sure our incredible EMTs and paramedics throughout the state, as well as coordinating with our emergency departments, have the additional training and support they need for not just the regular deliveries, which usually go fine, it's the more complicated cases. And this is where this funding focuses on and builds on work that we have done in the past. Secondly, along those lines of seeing a decline in locations where moms are able to deliver, we have freestanding birthing centers in the state, and during COVID in particular, they became strong options for moms when they didn't want to go to a hospital. This was where they went. But we've also seen those centers struggle and close for a number of reasons. This bill will take the time and work with the Department of Insurance and other stakeholders to really itemize those barriers and work to address those barriers. So regardless of where you are, you get the prenatal care you need, you get the delivery services you need, and should you have an emergency, that system is wrapping around you to take care of you. Again, great to see you. I'm so proud and honored to be part of this next stage of Momnibus and building prosperous, inclusive communities in New Hampshire with healthy moms, healthy babies, and healthy families. Thank you very much.
Thank you. Next up, it's my honor to introduce a friend, mom, and advocate, Dartmouth Health Children's very first ever maternal mental health navigator, Heather Martin.
Thank you. Hi guys, good morning everyone. We're back here for Momnibus 2.0 and I can't say enough about this crew behind me. Strong, powerful women that are doing this work to help protect our moms here in New Hampshire. So like Ken said, my name's Heather Martin. I'm so proud to be the first ever maternal mental health navigator at Dartmouth Health Children's, the first ever anywhere. Thank you. For the past 5 years, I've worked to help moms and families navigate the postpartum period through a successful screening and referral program of pediatrics. So part of this Momnibus 2.0 talks about screening in pediatrics. It must happen. This approach makes sense because moms always show up for their pediatric appointments and not always prioritize themselves for their own appointments. By meeting moms where they already are, we can catch maternal mental health struggles early and connect them with help they need before a crisis happens. Moms in our state need help. I know firsthand how critical Senate Bill 246 is for families across New Hampshire. My passion for maternal mental health comes from a devastating loss of my only sister to maternal suicide just 3 short weeks after the birth of her first child. No family should have to endure that pain, and no mother should have to suffer in silence. Right now, too many moms don't know where to turn for help. Momnibus 2.0 will make sure that no mother has to navigate these challenges alone. By expanding access to maternal mental health screenings, improving peer support, and making it easier for moms to get the care they need. We have an opportunity in our state to make a real change to support our moms before they reach their crisis point. We are losing too many moms to preventable outcomes like my sister. Strong moms in New Hampshire means strong families, and it's time for our lawmakers to step up and to support our moms. I urge you to vote yes for the Senate Bill 246. Thanks, guys.
Thank you, everyone. Next up, I'm excited to introduce Doctors Danielle Albushies and Janet Perkins-Howland.
Good morning, everyone. My name's Dr. Danielle Albushies, and I've had the great honor to practice OBGYN for over 20 years in our great state of New Hampshire. Thank you to the sponsors of this bill, appropriately called Momnibus 2.0. Both the New Hampshire American College of OBGYN and the New Hampshire Medical Society endorsed this important bill. New Hampshire has one of the highest rates of depression and anxiety for moms in the country. Behavioral health, including substance overdoses, is the leading cause of maternal mortality in New Hampshire. Let's change these statistics. Momnibus 2.0 provides a path forward towards this goal. This bill includes coverage for depression screenings under the state Medicaid program and will reimburse providers for this screening. When maternal behavioral health challenges are identified, care is needed promptly. This bill supports the establishment of a provider-to-provider consult line. Momnibus 2.0 increases a mom's coverage and reduces copays for perinatal mental health visits and substance abuse treatment, which will reduce barriers to this needed care. More than ever, New Hampshire moms are isolated. Details of this bill describe the launch of a study with the goals to increase access to perinatal peer support. New Hampshire is facing gaps in maternal and child health and wellness. Momnibus 2.0 addresses these gaps and supports families by expanding access to home visits up to 12 months post-birth of a child. Services such as maternal and infant nutritional needs or for emotional support.
Thanks. Excuse me. Thanks, Danielle. My name is Janet Perkins, and like Danielle, I've been lucky to have been an OBGYN in New Hampshire for upwards of 3 decades and a mom myself for about the same length of time. The gaps in maternal and child health and wellness are partly due to our state's rural nature. In addition, as Senator Prentiss mentioned, 11 maternity wards have closed in the last few years, which has been huge, 11. Momnibus 2.0 appropriates funds to the Department of Safety to support our wonderful rural maternal health EMS services. This bill includes a study to examine the barriers that pregnant patients experience to access a safe place to give birth in New Hampshire, which is what we all want. Momnibus 2.0 strengthens workforce protections. 78% of New Hampshire moms work during pregnancy, and 62% of New Hampshire moms plan to return to the workforce after giving birth. And a large percentage, a very large percentage, will return to work within just a couple of weeks. I was one of those people. This bill will expand employee protection to attend childbirth and postpartum appointments. We strongly urge our legislature to pass this bill. When we support maternal health, we reduce maternal and postpartum deaths. We reduce maternal depression and mental health challenges of patients. We support the health of the baby. We lower costs for new and growing families, and we reduce poor health outcomes. Let's make this happen, New Hampshire.
Thank you so much. Thank you. Our last speaker, and last but not least, and maybe the most important voice in this room, I'm pleased to introduce mom, friend, and amazing advocate for moms and families, Julie Mudd from Bedford, and Hank.
Hi, good morning, good morning. I told him what we were doing, so we'll see how this goes. I'm excited to be here this morning. I want to thank Nancy and Ken's and the whole team at Moms Rising for rallying to build support around this bill. I'll introduce myself. My name is Julie Mudd. I'm from Bedford. I am one mom of a two-mom household. We have 3 boys, 17, 14, and 1. So I'm a wife, I'm a social worker, and I'm a parent coach. You'll find me currently working with young homeless families as a parent coach that have entered into a housing program at the Home for Little Wanderers, or a grant-funded housing and support program to build young mothers and their families up. I've been a certified parent and life coach for more than 16 years, not just educating young parents in the process of childbirthing and child rearing, but always advocating for parents in any capacity that I can. I can think of nothing that would be more important to our community members than finding a way to build up our mothers. As a communities of people, we're short-sighted in our efforts to be transparent and forthcoming regarding both perinatal and postpartum mental health. Unfortunately, New Hampshire suffers from one of the highest rates of depression and anxiety in our maternal demographic. I can tell you, in working with the demographic that I do, the limited access that we have to appropriate mental health facilities increases the rate of substance abuse in mothers. We don't have to talk about the downward spiral that substance abuse is, but we find it more often when we don't have access to immediate mental health supports. All women are vulnerable to postpartum depression, all birthing people, regardless of age, marital status, education level, or socioeconomic status. It can affect your wife, your best friend, or your sister. PPD isn't discriminatory. Unfortunately, access to care is. I can remember people asking me what I wanted to be when I grew up, and as a child, I always said I wanted to be a mom. And after suffering from miscarriages and struggling with bouts of infertility, I found myself successfully pregnant with our first child. The sparkle fades from a long-awaited pregnancy that was met with a horrible case of PPD. 17 years ago, I had a team of doctors, nurses, and a community of other parents that allowed for the gradual improvement of my mental health. Today, the lasting effects of an eternally painful pandemic, a tense political climate, has limited community education, tools, and resources. Maternal health is community health. Momnibus 2.0, or SB 246, broadens the community education, tools, and resources that moms need. I would like to thank the co-sponsors of the bill for listening to the constituents and recognizing the importance of supporting moms in the Granite State. This is more than about just policy. This is a prioritization of moms that has a ripple effect in our communities. Sorry to bore you. It changes lives and will contribute in extraordinary ways to extraordinary outcomes for families. Now let's get Momnibus 2.0 and all of the amazing things that it does to expand maternal mental health care, strengthening workforce protections, and support moms across New Hampshire. Provide real, tangible family supports over to the governor's desk. Thank Thank you.
Well, folks, I think you heard it best from them. Today's going to be a really powerful day in Concord for moms and families, and we're looking forward to seeing Momnibus 2.0, Senate Bill 246, pass through the Senate with flying colors. So thank you again for being here. We're happy to take questions if you have any.
What is it about New Hampshire that makes it have one of the highest maternal depression rates? Why is that?
Maternal depression, anyone? Why does New Hampshire have high rates? Go ahead. Go ahead, Allison. Make sure you introduce yourself when you come.
Hi, my name is Allison Palmer. I'm a women's health and psychiatric nurse practitioner. I work with Hope on Haven Hill, and I've been working in this field for about 20 years after my own postpartum depression and anxiety. I think we don't have a lot of specialized providers that are dual certified for perinatal mental health. And what I often see is like this hot potato mentality. We have OBs they care for the pregnant mother. They're not trained in psychiatry. We have the psychiatrists who see a pregnant woman or a breastfeeding mother and say, oh my gosh, I don't know I'm not sure if I should be prescribing for this woman. So they might take her off all medications, causing a destabilization. Then we see mothers, like Heather was saying, we have moms that will come prioritize their children's care, and they'll come to their pediatrician's appointment, maybe not their own. The pediatrician is a great place to screen and to identify moms that are struggling. However, the pediatrician is not the mother's primary provider. So who owns the mom? So this is a part of our fragmented healthcare system that I see a big piece of our struggle. So this is where Momnibus 2.0 is filling in the gaps with peer-to-peer clinical consultation and also peer supports, building other community health workers with certified peer support that they can see in the home and in other areas where they intersect with these moms.
Thank you, Allison. And hi, I'm Mackenzie Nicholson, Senior Director of Moms Rising in New Hampshire. And I'll just, to add on to Allison's points, Kevin, when moms don't have the support they need, and what does support look like for moms, right? Childcare, paid family leave. Those are added stressors. When moms are feeling the weight of not having access to those supports, it absolutely contributes to mental health challenges and postpartum depression. Thanks. Yeah, go ahead.
Yeah, the last speaker mentioned, I think something about just the lack of access to mental health care for new moms and pregnant women, and I'm wondering, is that just part of the overall lack of access we have in the state, or are there specific needs there that aren't being met, or we don't have the right, facilities, trained providers, et cetera?
I might bring up one of the sponsors to answer this question around.
Sure. Thank you for the question. I think, well, here's what I know, and it reflects on what the last speaker said and what we've been talking about today, is that there are, the system as it is right now has specialty areas that aren't intentionally siloed off but need to communicate with each other. And so we heard, like, you'll have an obstetrician who's great at delivering babies, but maybe does not have the strong depth to deal with a postpartum depression, knowing that mental health is key to what we're talking about here in Momnibus. We have to close those silos and bring this basically a wraparound approach. So it's a lack of access, but also we're hearing that as we've been out talking about this the last 2 years since Momnibus 1.0, that it's a lack of coordination. So bringing, a call line that obstetricians and moms can use to get support, as well as peer-to-peer support, will help to bring those folks all together. Thank you.
In regards to the 11 labor deliveries that closed across the state, how does this compare with the rest of the nation, and how can New Hampshire try to repair the loss of all of those labor and delivery units and skilled care folks, especially in the rural parts of the state?
I I can't speak to what independent birth centers look like across the nation, but I'm sure one of my colleagues can behind me. But I'll just share that one of the provisions that we talked about in Momnibus 2.0 is asking the Department of Health and Human Services to study barriers and the sustainability of independent birth centers. And we know that over the past few years, we've lost birth centers. In fact, when we started talking about Momnibus 1, we think we had 5, and now we have 3. And so what does it mean? We really need to have some answers about what are causing the closures of those independent birth centers and how we can support them better to make sure that moms have access to the care they want and need, because when they have access to those options, the outcomes are better. Is there anybody else who wants to speak to independent? Sure, go ahead, Heather.
I just want to speak about like the lack of mental health providers. It's perinatal mental health. It's a specific resource. And also to build access, we talk about moms feeling isolated, right? We're going to build a peer support network. So it's going to be moms that have been through similar circumstance. We all go through things as moms. So if we have a peer to help guide us through that, it's not necessarily about a mental health provider or medication. It's all about those, like a community, building that community. And that peer support is going to help repair how our moms feel isolated. So that's a huge piece of the bill that we've been advocating for. So let's get this passed. Let's get that that peer support for our moms to feel like they're not alone.
Let me just real quickly, I want to, in response to that question, just want to reiterate that this bill may not address the closing of those 11 labor and delivery centers, but it just, the question highlights how important it is that our EMS professionals have the robust training so that they can deal with any situation that's put in front of them, because more and more they're the ones taking on the burden and the joy, but of really making those places, those births safe.
Is it on par with national standards, or is this a nationwide trend, or is this in New Hampshire?
I don't know if I can speak to individual states. I do want to just bring light to the fact that it is happening in rural areas across the nation, and it really has to do, if you think about it, the fiscal burden on places. It is, I think, very unfortunate that having a baby in the U.S. is supposed to make money, and if you only have, 30 births in your hospital, you're not going to be able to support that without losing tons of money. And then just one other thing about the whether we, in New Hampshire have increased rates of depression and anxiety. I just want to bring light to the fact, too, that there's often dual diagnoses of substance use disorder and mental health challenges, and we do know that we have struggled with substance use disorder in New Hampshire.
Any other folks? Ms. Merritt?
I'm wondering if someone can speak to the disparity that exists between Medicaid coverage for mental health and private insurance, and how that manifests when addressed specifically within this bill.
I think we'll ask our colleague Rebecca to take care of that.
So Momnibus 1.0 and some policies. My name is Rebecca Wojtkowski. I'm the Child and Family Policy Director at New Futures. I've been lucky to work many years on maternal mental health policy in New Hampshire. We have made a lot of inroads to providing coverage for substance use disorder and mental health treatment through our Medicaid population. But in New Hampshire, the majority of babies that are born are to privately insured families. So Momnibus 2.0 addresses that by increasing access to all moms in New Hampshire, and in particular, expanding access to home visiting for the first 12 months of a baby's life. Home visits are really crucial to identifying postpartum depression or mental health challenges early on so that moms can be referred to other services within the community. So as we think about addressing some of those gaps, we have to look at every single mom and how they are insured. We've done great work in our Medicaid population and other targeted populations, but at this point, we're not doing what we need to do for privately insured families in New Hampshire. Thank you.
I might be running out of time. Yeah, go ahead.
Just to add on to what Rebecca was saying, I would say among my colleagues that work in mental health, and even especially the specialized providers that do perinatal mental health, many of them are not taking Medicaid, many because it does not reimburse well. So we have a disparity in access to care in that regard. And then we also have, there's insurance in general is not always reimbursing well. So you have a whole subset of providers that are not taking insurance. And so this is where, again, it falls to this hot potato mentality of then now who is taking care of mom? Now the OB has to own it, the primary care has to own it, they don't have the specialized training, and we're back at square one again. So just another aspect.
Thanks everyone for being here today. We're going to wrap it up. We're going to go across the street for Momnibus 2.0, Senate Bill 246 first hearing. Let's do this for moms. Let's go. Thank you.